Hello, I'm Elizabeth Koff, Managing Director of Telstra Health, and I'd like to welcome you to our conversation with Matt Bardsley, the Chief Executive of MedicalDirector. Welcome, Matt.
Thanks, Elizabeth.
Before I start though, most importantly, I'd like to acknowledge the traditional owners of the land on which we are located today, the Gadigal people of the Eora Nation, and pay my respects to elders past, present and emerging. It's been quite a year for everybody in health, or quite frankly, quite a couple of 2 years for everybody in health with COVID. And MedicalDirector's been on an extraordinary journey through that period, both through COVID and then working with Telstra Health. So really I'd like to start by asking you, Matt, tell us a little bit about the journey of MedicalDirector pre-Telstra Health.
Yeah, so thanks Elizabeth, and I can only imagine we were a small part of that COVID journey, and your role previously as well had, obviously a lot of burden was taken on your shoulders for that COVID response. So big thank you to you and the team of New South Wales Health to help support us through that. Yeah, so at MedicalDirector we are obviously part of that journey as well, and so a couple of years ago we recognised that a lot of the outbreaks were happening in general practice, and we had a phone call from the Minister's office back then to say, what can you do to help us with that? And I was so proud of the organisation and the team at MedicalDirector, where they jumped straight to the challenge and we deployed telemedicine across all of our customer base within 10 days. That's unheard of. And it was just an amazing response from the team. So super proud of everything that they did through that time. Obviously, throughout that whole couple of years, so many changes coming so quickly to general practice. So our team were feverishly from their kitchen tables and lounge rooms and spare bedrooms, working as hard as they could and as diligently as they could to do our bit in supporting the response to COVID. So look, it's been an epic journey from that perspective. And then during all of that, we also embarked on finding our next partner for MedicalDirector. And obviously we were previously owned by a private equity organisation, and so inevitably they always end up needing to sell their asset forward. And we engaged with a market sounding, and Telstra Health came forward, and that excited me a lot, Elizabeth, because I think there is absolute understanding that an Australian-owned organisation that owns us will do nothing but be a net positive to the outcome of what we need to achieve at MedicalDirector. And all of the assets that Telstra Health already have in its portfolio, we recognise that MedicalDirector could be and do so much more with them as well.
Becoming part of Telstra Health represents a new move for MedicalDirector, and Telstra Health actually is a wholly owned subsidiary of Telstra, which is the major communications provider here in Australia and has services internationally. What do you see were the main benefits or potential synergies that could be derived for being part of Telstra Health?
Yeah, really good question, Elizabeth. There were so many exciting opportunities with the Telstra acquisition, strengthening ourselves in many aspects. So if I talk about a couple of those points, so first of all, our customer care and our ability to service our customers. Obviously, Telstra and Telstra Health have got a great knowledge and understanding of how to improve call centres and how to really strengthen those areas. The other one was around the security side of things. Obviously, having the largest telecommunications organisation and then also Telstra Health behind us, it's lifted the bar in terms of what we need to think about with our own internal processes around how we continue to improve the security of the systems that we write. So another great example of how that has really improved the outcomes. And then finally, it was the clinical support. We have amazing clinical capabilities in the organisation, but then broadening that into the broader Telstra Health portfolio brings a whole suite of clinical insights that can be augmented with the ones that we have within our general practice focus. So we see a strengthening across the clinical delivery as well within MedicalDirector. So I think those three things were the exciting ones. And then what we spoke about before, Elizabeth, just all of those opportunities that we can now all get after to improve the health outcomes of Australians with all of that strength behind us can be nothing but a net gain for everyone.
That's great to hear, and part of a connected system. So that's another benefit. Thanks, Matt.
No worries.